You know, we've been talking about all the smoke and how bad it is to the air quality. Dr. Cyrus Rangen is on the phone with us. He's with the LA Department of Health. What can you tell us, Cyrus? What's the best way to protect ourselves?
Well, thank you for having us. I think first and foremost, just to make sure that whatever you do, always listen to your local first responders. There are a lot of changing conditions, and no matter what those conditions are, listen to your first responders about what to do next. Second issue is to try to avoid outdoor activity as much as you can. Any non-critical outdoor activity should just simply be avoided. If you see and smell smoke, it's best to remain indoors, run your central air, keep those windows closed, and certainly just simply leave the area if it's causing any problems from a symptom standpoint. And if you are developing symptoms, those can be through the eyes, the nose, the throat, the lungs, etc. And anyone who has any current or chronic disease, especially heart or lung disease, and if you're on any medication, make sure to remember keep those medications with you at all times, especially if you have to evacuate. You may be more sensitive to the effects of smoke than other people as well.
Terrific advice.
Dr. Rangen, does age have a factor in this, whether you're a young child, an elderly person?
Yes, definitely. We find that in these situations of poor air quality, whether it's from a fire or for any other reason, generally the very young and our senior populations are the ones who are generally going to be at higher risk than most others. So be careful if you have members in your family who are in those categories that they may be the ones who are more sensitive than the rest of you.
You know, there have been some suggestions that we wear masks. Does that really work?
Yeah, in fact, masks, we have been asked that question a lot over the past 24 hours. And in fact, masks could really work against you. We actually do not advise the routine use of masks throughout the day. If you need a short-term use of a mask just to get from one place to another because of heavy smoke, that's certainly reasonable. But by and large, these sort of hardware store masks or sawdust masks that you can get generally can cause more problems than not because they don't filter out small particles very well. They don't filter out gases very well. And they can give people sort of a false sense of security that you can be outside in the poor air quality for an extended period of time. In addition, moisture tends to build up in those masks as well, and that supports microbial growth. So in all, you could actually put yourself at higher risk by using these masks. So if you see and smell smoke, best is to just avoid it by being inside or simply get to another area.
Yeah, indeed. Of course, we also have to be concerned about the eyes, too. I mean, with all the smoke, it really does hurt people, especially those wearing contact lenses, right, Doctor?
Sure, that's very true. And if you want to wear any kind of goggle protection, that is certainly a reasonable thing to do. You would want to use goggles, of course, that form a relatively good seal around the eyes, because if it doesn't, then all you may do is simply trap more of the debris and the bad air quality simply right around your eyes. So just use those kinds of things with caution and use them on a very, very short-term basis if necessary.
Dr. Rangen, we're giving very good advice to prevent these things from happening. The LA County Department of Health keeps track of admissions to hospitals for specific reasons. Have you had any information that people have come to doctors or hospitals because of the problems we're talking about?
Yeah, without question, people are experiencing a higher, degree of those kinds of symptoms. It's a little bit early to say what the numbers are from that standpoint, but without question, people, especially with chronic disease, are the kinds of people who tend to get these symptoms a lot more quickly than others. So the cautionary note for families is that if you have people, as we mentioned before, who are very young or who are in our senior populations, or if you have heart and lung disease or anything related to those, and if you're on chronic medications, these are the folks you want to protect the most and get them out of those areas if possible.